report the estimated 1 in 200 people in Canada with the disorder.
It is the most common form of any neurological disorder or developmental disability found in children. Characteristics of autism spectrum disorder can include trouble with social relationships and deficits in communication or language.
And there are many types of interventions available to help some of these symptoms. One of them is music therapy.
Now, if you don't know what music therapy is or how it can help people living with autism, well, that's okay, because we're about to show you.
Anna Delaney sat in on a session with accredited music therapist Renee White and high school student Evan Richard. Here's a look at how music therapy helps Evan.
Renee, you're an accredited music therapist. Can you explain to me exactly what music therapy is?
The simplest explanation for music therapy is that it is the use of music to work on non-musical goals. So basically, any person who would have any goal area that they'd like to work on, there is an intervention that could be done with music therapy to reach that goal.
It's not to get better at music, so that's where it differs from like a music lesson.
And that would be the difference. So music education, the goal is to learn music. You may get non-musical goals along the way, so learning piano, of course, you will get better fine motor dexterity, but that's not why you're going to piano lessons. Whereas music therapy, you'd be coming to increase your fine motor dexterity. If you learned piano along the way, that would be great, but that isn't the goal.
There are many different populations that a music therapist can work with. You work a lot with people with autism. Why does music therapy help people who have autism?
First off, autism is a neurological disorder. One of the theories behind what's going on with autism is that there are too many synapses in the brain that are just kind of misfiring. Music, however, is very organized and structured. So what happens is when you're engaged in music making, the brain is kind of able to use that organization and structure, so it kind of supports all those synapses that are firing. So if we're working on a communication goal, the music is helping support that communication happening at the same time. A lot of my clients also work on attention goals, so just remaining engaged and in the moment and not getting lost in another thought or not getting caught up in another sensation. Music also keeps them in the moment, it keeps them in time, so it's really good for attention goals and communication mostly.
So Bev, you are Evan's mother. Evan's been doing music therapy with Renee for almost 3 years now. Mm-hmm. How did it become about? Why did you enroll Evan in music therapy?
Well, Evan's always enjoyed music. He's been going to the Autism Centre. He's in a social thinking group. He was at a day camp, and they advertised that there was a drum circle. There was a man coming from BC. And Evan's always been interested, like say, in the beat of music, so he went to the drum circle and really enjoyed it. And then we heard about Renee doing music therapy, so he started with Renee.
Renee was the music therapist at the Autism Centre.
She was.
Yes. So what did you think of that initial drum circle, Evan?
It was good.
Yeah. What do you... the drum is your favorite instrument, isn't it? Yeah. What do you like about the drum?
I like keeping the beat.
What would you say to someone who maybe doesn't really know what music therapy is or understand what it is?
Well, it just opens up. I think a lot of people think it's learning music, but it just entails so much more. It's musical, yes, but it is used in, just their fine motor skills, playing the different instruments, the turn taking. There's a lot of other things involved besides the music.
Over the past 2 to 3 years that Evan's been doing music therapy, what sort of changes or effect have you seen?
His self-confidence, his self-esteem is just soared. If anyone had asked him, even last year, to do this, there would have been a definite no. And I was so proud. Yeah, that's the big thing that I see, yeah. Much more spontaneous, like in initiating conversations, much more comfortable with himself.
Mm-hmm. You're very grateful to music therapy, I can tell.
Very grateful. Very grateful to Renee, yeah. She's a good friend.
When you have to purchase batteries,
why do you like coming to see Renee every day?
Well, do I like coming? To sing different new songs.
And you play a bunch of different instruments. What kind of instruments do you play?
I played the cue chord, and the xylophone, and the gyro, the little xylophone.
And you sing as well, don't you?
Yes.
Do you like to sing?
I like singing.
You've been working with Evan for about 2 to 3 years. What sort of changes have you seen in him from when you started 2 to 3 years ago to now, what you see today?
Overall, there was a real lack of expressive communication. Receptively, Evan understands everything you ask him, but getting the answer out is really difficult. Just initiating the answer, for some reason, we don't know why, but the communication, the messages that need to fire in sync just kind of don't happen as fluidly as it does for most other people. So with music, I've noticed the biggest change in just how much more comfortable he is with talking. So his communication, both with singing and when we are just talking within a session, is just much more relaxed.
As a music therapist, when you see a growth in someone like Evan, who you've been working with, what does that do for you?
Well, it makes me very happy, obviously. It's why I do what I do. But overall, I think what it is it's showing that there is a way for these teens to be successful and to be gaining something other than just feeling good about what they're doing. So Evan comes in under the total impression that he's just there making music. And the wonderful thing is he's getting all these other benefits from it along the way without feeling like he's coming in and having to work for it. No one's saying, today we're going to work on your fine motor goals. He's just coming in and doing music. But the fine motor goals are built in already. So it's just wonderful. It's nice to be able to see somebody making big strides and just being happy to be coming along with you and your plan for his therapy.
Well, thanks very much to Anna Delaney for that story.